Good afternoon, everyone. You are very welcome to today's event. The panel will be delighted to receive any questions you may have. Please use the Q&A feature that is located at the bottom of your PC or laptop screen. If you are using any other digital device today, you may find this located in the More section, usually identified with three dots. Now, without further ado, I'm going to hand you over to your host for today, Lorcan Brennan. Thank you.
Thank you very much, Jean, for the introduction, and as always, being with us here today. It's fantastic that you're along with us and minding us in the cyber world. And also, I have beside me as well Michael Feeney. Michael's here from Irish Sign Language, and we've worked together before, Michael. I feel great and comfortable having you here beside me, spreading the message in relation to International Men's Health Week for 2026. So you're all very, very welcome, folks. This is our preparation for Men's Health Week for the year ahead. It's landing on Monday the 15th of June until Sunday the 21st, always, as we know, ending on Father's Day. And today is one of those days where we come together and we start a conversation in relation to how we can prepare and get involved and activate the week in a really positive way. So I'm really delighted you could make it along. We know a lot of people come along and watch this afterwards as well to try and get ideas literally around activating the week. Now, you'll know that these webinars are a part of a series that are partnered across the year, and there's a number of people who are involved in it that make it happen. The HSE are very much at the back of it, of course. We have the Men's Development Network, we have the Men's Health Forum in Ireland, and we also have the Men's Research Centre in Setu, which is based in Carlow. And of course, 100+ partners as well who are out there working to make International Men's Health Week and other events happen across the year as well. Back in December of 2025, we started this conversation, and across three other events, we've arrived here at this webinar today. I think we had 40 on from different organisations in December, starting to think about what we could do in relation to International Men's Health Week for 2026. And it leads us to today, and we have a team, one step at a time, progress, not perfection, that was arrived at by a lot of people in conversation, and that's going to make hopefully a difference to how we go at marking and celebrating the year on the island. Now, in a few moments' time, we're going to have four participants who are going to come on and tell us the story of how they've been involved organisationally and individually in relation to International Men's Health Week in the past. But before we even do that, I think we're going to bring on somebody that you all know who's not with us here today, and that's Collie Fowler. Collie has been really an amazing, I suppose, person in relation to working with the Men's Health Forum in Ireland, in framing the week year on year, and in putting together a lot of resources with his team in relation to how we can get involved and why we actually should be having a conversation even around men, our health and our well-being. So just to frame that for us, to get us up and going, I'm going to invite you to sit back. I hope you have a cup of tea or maybe something, a light refreshment, and watch Collie telling us exactly why we should be here, why we are here, and maybe what we can do as a framing for our week ahead. Thanks very much. Collie Fowler, great to see you. It's that time of year again. What's another year, as the old song says? It's coming up towards Men's Health Week for 2026, and it's fabulous to have you here today again to tell us a little bit about it. Collie, it's going on forever. You're at the heart of everything that happens on the island of Ireland in relation to Men's Health Week. And so, can you tell us a little bit about it for the novices on here today? Maybe somebody's on, they don't know much about Men's Health Week. Can you start by telling us a little bit about that? About Men's Health Week itself. What is Men's Health Week?
No problem at all, Lord. And great to be back and talking again about Men's Health Week. It seems like only last week, but here we go a year later, or almost a year later. Well, firstly, I suppose, what is Men's Health Week? Well, it's international. It happens every year, and it always begins on the Monday before Father's Day, and Father's Day is always the third Sunday in June. So that's how we gauge when Men's Health Week is every year. But why do we have a Men's Health Week? Well, everyone probably knows that men make up about half of the population on the island of Ireland, but maybe not as many people know that men's health isn't quite as good as it probably should be. But it's not a lost cause. There are things that we can do to improve that health, and that's what we do in Men's Health Week. We have this very positive message of taking control and doing the things that we can do to change the health and well-being of men and boys in the island of Ireland. And there's kind of three things that we try to do. Firstly, we try to heighten awareness of preventable health problems for men of all ages. Secondly, we try to support those men and boys to make healthier choices, to have healthier lifestyles, and to take a wee sort of bit of control on what happens in their world. And lastly, we really want to encourage men to come forward early to detect and treat any problems that might exist for them.
So, Collie, is it for all men, every man, or is it for services is for everybody? Who is it for when you sit down to plan? Who have you in mind as the end target for Men's Health Week internationally?
Yeah, Lorgan, everyone is the key word really, because Men's Health Week is for everyone. We obviously target men themselves and we try to ask them to do something individually, but it's a bigger picture than that. We're also saying to the policymakers, you have to have a think about what resources you put into men's health and what structures you put in place to promote men's health and to support it. We say to the service providers across the island of Ireland, what are you doing for men, if anything at all? And is there a way that you can tweak your services to make them more male friendly and male inclusive? And of course, for the general public, we're really keen to get them on board as well to support the men in their lives. And women have a great role to play in men's health. We're not asking them to take responsibility for it, but to be that person who nudges the men in their lives along, their brothers, their husbands, their sons, their uncles, their fathers.
And Collie, when you were saying about that, that everybody can be involved, and we know, for example, you have highlighted it there that literally beyond gender, many people play a major role in relation to uh, what is men's health. For this year, there's over 100 partners, I think, that have sat down to be part of the planning in relation to Men's Health Week. So every year there's a different theme. What's the theme for this year, and how did you arrive at that?
Well, firstly, as you said, we have 100 odd partners, just slightly over 100 partners this year. And those are organisations of all shapes and sizes across the island who give their time voluntarily to come together to meetings, which are quite long sometimes and quite big, to give their input to voting on what images will look like, what messages would look like, what themes we should be focusing upon. And after a whole load of meetings and a lot of hours of voting and meeting, that group of people came up with a theme for 2026, which is this idea of one step at a time. And under this one step at a time, I suppose you could have 1,000 sort of strap lines or catch lines or taglines. But what the real aim this year is to say to men, look, it's all about making progress. It's not just about being perfect. Don't put yourself off by saying, I have to do 10,000 steps a day if you've never moved off the chair in the last fortnight. Don't say, I have to eat 7 fruit and vegetables today if you never eat any. Start as small and simple and practically and realistically as you can, one step at a time, and celebrate every step that you make a big deal of it and make sure everybody else knows about it as well to celebrate with you.
Okay, so one step at a time. It's really, really good to go in that direction. Everybody's going to be looking at how to get involved, and especially in relation to resources. We can't do anything without resources. Year on year, you have with the team developed really good resources. What are the resources for this year that people can lean in towards and follow you up for and say, Collie, send me on these. I need to have a group here in West Clare or wherever.
Great, Lorgan. Yep, every year we try to give people as many tools as possible to celebrate and mark the week. If you have a look at what happened last year, if anyone wants to have a look at last year's resources on our website, you get a better idea because they're only in the progress of being made at the moment. They should be ready by the end of April, start of May. But they include a website, a web hub where you can find information on absolutely everything you need to know about Men's Health Week in Ireland. It'll include hard copy and soft copy posters that you can put up in your shops, your community centres, your men groups, your bookies, anywhere you like in public spaces. There's some postcards that you can give to the men that you know, post it to the men you know, give it to your employees. There's lots of graphics, logos, badges, banners that you can put on your website, you can put on your email accounts, you can put on your Facebook pages if you like. And of course, there's the world of social media. But we're not even leaving it on your own. If you want to do something, just cut and paste some of the messages we can give you for each day of the week and put it up on Facebook or Twitter or TikTok or Instagram and promote the week. And I suppose our two big things for the week that mightn't show up on screen, but are our Do You Know Your Numbers Z cards, which are very hard to see against this background. And also, of course, our Action Man booklet, which is probably one of our star attractions every year.
Excellent, excellent.
And all of those are available for free to anyone who'd like them.
Now free and available. And where did it go, Collie? Because you have a website that most people might know who are part of Men's Health Week, but just give us a call out there again on where to go and how to find those resources.
Of course, Lorcan. Really easy to find it and a really easy web address, mhfi.org. mhfi.org. And on that landing page, there'll be a big banner telling you where to go and find everything. You don't have to remember anything more complicated than that.
There's our colleague, and just an amazing ambassador on the island of Ireland for men's health. Does so much really super work in relation to it, and anybody associated with the week knows about Collie for sure. So not with us today, but definitely there giving us a map on where we go, what we do, and how we can be about it. Now, our first participant, who's going to tell us a little bit about their own work out west in Galway, is Aisling Culreevy, and she's Healthy Galway City Coordinator. And Aisling has worked as Healthy Ireland Coordinator of Galway City since 2022. It's our fourth year in partnering in relation to the, I suppose, HSE and other agencies around the annual men's health events. And she's very interested in, I know, working with communities that are at risk of marginalisation, but also very much part of a multi-agency approach in the committee work that you do in relation to promoting healthy cities as Galway is. So Aisling, your slides are up. You're very, very welcome. Take it away. Thanks very, very much.
Thank you very much, Lorcan, and good afternoon, everyone. Thank you so much for joining us today. So as Lorcan said there, I work as the Healthy Ireland Coordinator for Galway City Council, and I'm just going to use my time today to speak to you a little bit about how easy and enjoyable it is to get involved locally in your Men's Health Week. So whether you've done it in the past or you're thinking about doing it for the year 2026, I'm here to encourage you. It really, really is a great initiative to be involved in, and very straightforward and simple. I can tell you a little bit about how we got involved through Healthy Ireland and the work we here do in Galway City and County. But just for those of you who don't know, Healthy Ireland is a national government-led strategy that's aimed at improving the health and well-being of everyone living in Ireland. So no matter what city or county that you're living in, no matter what local authority you're involved with, there will be a Healthy Ireland coordinator. So if I can give you one piece of advice, it's if you're involved in planning something for Men's Health Week in your community, reach out to your local Healthy Ireland coordinator, and they should be able to give you great support and help you with whatever initiative. We'd only be too delighted, because this really is our bread and butter, is targeting people who need support the most. So like I said, there is one of us in every local authority, so be sure to get in touch with us. So I'm just going to change my slide there. I hope you can see it. Let's see.
So Aisling, if you come down, yeah, there we go.
There we go. Yeah, so like I said, I'm just going to give you a little bit of an idea how I got involved in the Men's Health Week programme. And I have to say from the start there that I want to just mention Lawrence Gahan in the Community Healthcare West health and wellbeing sector. Lawrence is really who was integral in getting the Healthy Ireland programme in Galway City, Galway County, Mayo and Roscommon involved in the initiative. I'll talk a little bit more about his role throughout my slides, but just wanted to say that Lawrence, his colleagues John Hawk and Mary, they're in the HSE. So we work very closely with the HSE in our rollout for Men's Health Week. So there's just a few images from Men's Health Week over the years that we've been involved with. But yeah, to give you a brief idea, but I want to say, how did Healthy Galway City get involved in Men's Health Week? Well, I can say that we've been involved for the last 4 years. We initially got involved with, in March 2023, I became aware of the Engage training, the Connecting with Men training that was ran by Lawrence Gahan of the HSE and his colleague. So the training was all about what community groups, organisations, agencies could do to target men locally if their initiatives were related to health and well-being. So, I was very interested in that. As Healthy Ireland coordinator, we would coordinate a lot of different activities and programmes targeting people, especially people that might be from marginalised communities or those that might experience disadvantage or barriers to accessing health and well-being programmes. So we did find that a lot of our initiatives were being taken up by women, but less so by men. So that was where the interest came. So after the training, I went along with one of my colleagues here in Galway City Council, Peter, who is a social worker in the housing section. And Peter reached out to say that he'd like to plan something for Men's Health Week in 2023, and kind of coincidentally, Lawrence also reached out to say that the HSE would like to partner with us to plan an event as part of 2023. So we began planning and partnership working throughout April 2023, and then that continued into May with our first event taking place in June 2023. It was our Men's Health Hub initiative, and that was specifically targeting men experiencing homelessness. So like I said, working with my colleague Peter, the social worker in Galway City Council, we ran an event in Áras na Gael in Galway City, and it was kind of, I suppose it was straightforward enough. It was a health information event specifically targeting men experiencing homelessness. So we had the likes of the HSE, CRE, the Heart and Wellbeing Foundation, the homelessness services and the housing services in Galway City Council, the library services, but we also had the likes of our education training board there, so they could talk about education opportunities. We had the local employment services, because obviously health is not just, I suppose, your cholesterol levels or your blood pressure. It's also your quality of life, and for many men experiencing homelessness, that would tie in very closely with housing, with education, with job opportunities. Then again, we had such a great experience, and I really recommend that everyone gets involved, that next year when the call came to start planning, we were right there, and we were very keen to be involved in what we called our Healthy Men Happy Tribes event, which took place in St. Patrick's Band Hall here in Galway City, very close to the train station. And again, this event was that kind of health information style, but it was a broader remit. It was open to the general public. We did target men experiencing homelessness and men living in IPAS centres, but the event was open to anyone and everyone, whether it's somebody who is working in an office who wanted to come down on their lunch break. And we had loads of lovely things like heart health checks. The Marie Keating Foundation was there to talk on specific cancers that might affect men more commonly, and there was a little bit of something for everyone. We even had barbers there who were providing free haircuts to men who came along. So I always say with events like this, it's lovely to have something, the carrot, something that's nice and it'll get men in the door, something that's light and entertaining and attractive. So it might be music or food or entertainment, or in our case it was the barbers, but then they also have the opportunity to go around to all the different tables and meet with different organisations. So again, in November 2024, to mark International Men's Day, which is different from Men's Health Week, we partnered with ATU to run an event specifically targeting male students. So just to give you an idea, I know a picture tells 1,000 words. Here are some pictures from some of our events. So I mentioned the Men's Health Hub targeting men experiencing homelessness. That was in Áras na Gael. This gives you a little idea of what we were offering on the day. Then followed up in 2024, and of course you'll have seen in these pictures the men's health events in Galway always get great support from the political leadership. So it's attended by the mayors of Galway City Council in over 2023, 2024, 2025, and really it's the community groups that make these events really special. So the ATU International Men's Day, we had a panel event, and we also had our barbers working there as well, and as you might imagine, very popular with students looking to save a bit of money. I can thank again Lawrence and his team for this little infographic. Just in 2025, this gives you an idea of the events that were held in Mayo, Galway and Roscommon, so Galway City and County. And these events, our event was quite large, reaching a lot of men, but they do not have to be big. You don't have to blow the budget on these. They could be very, very small, very local, and any amount of engagement that you're getting with men, be it small groups that are already existing, men's sheds, or it's bigger events where you have the opportunity to reach 100 or 200 men, all of it really adds up. So there's a little infographic about men's health at a glance, letting you know 31 events in total, nearly 3,000 interactions and 13 type events. So everything from health checks to sports activities to men's sheds events to physical activity programs. And here we have some of the media capturing the successful events in 2025. And in this picture, you'll see Lawrence and John as part of their events. And as I said already, your events are only as strong as who's involved in it. So this gives you an idea of the incredible amount of partners that are involved in Galway City, Mayo and Roscommon. But I would advise you to think locally, think of who your partners are already. We work really closely with our local development company, Galway City Partnership, so we wouldn't imagine organising something without having them involved. This year, we're also looking at doing an event specifically targeting traveller men, as we know that they experience some of the greatest health inequalities of anyone living in Ireland. So we're really excited to be partnering with Galway Traveller Movement for an event this year during Men's Health Week. So that is my piece. I'll just stop the share there if I can figure
Well
it
done,
out. And
Aisling.
thank you very
So
much
much
for your
there that we
time.
can talk about as well in a few moments' time when we go back and have a bit of a chat on the couch, as to say, thanks so much for that. And partnering greater than the sum of the parts, and especially engaging with men, maybe that might be a challenge, or you might feel that really needed the support that was there, and you step up and you go and do it. So we want to talk more about that when we bring you back in a little while. And Lawrence and his team, of course, out west there, the West is awake for sure. So we'll talk to you soon. That's amazing, folks. We'll talk a little bit more about that when we go back to the couch in a while. Look, at everybody as well, I suppose, has heard of Park Run. We're going to keep moving here. And I have Tara Gleeson here with me as well today. And Tara is very involved, as I say, communications and partnership manager with Park Run. And she's going to tell us a little bit as well about how this kind of initiative, I suppose, it's just known right across Ireland at this stage, and especially in the context of being framed for International Men's Health Week, so many people take part. So Tara, I'll let you tell us your story, and then we can talk more when we go later on to the couch.
Brilliant. Thanks so much, Lorcan. And morning, everyone, or early afternoon, I should say. I hope you're all keeping well. And yeah, thanks so much for the opportunity to have a chat to you all today about Parkrun in Ireland and how we celebrate Men's Health Week in June. So just want to start, I suppose, by first explaining maybe to those of you who've never heard of Parkrun or know what it's about, or what exactly happens at it. So Parkrun is a 5K weekly event. It takes place on Saturday mornings, so every week, and we have most events starting at 9:30 a.m, so nice and early on a Saturday morning. It does have a sister event as well. Also, it's called Junior Parkrun. That takes place on Sunday mornings at the same time, but it's a shorter distance of 2 kilometers, and it's mainly aimed towards 4 to 14-year-olds for them to take part with their friends or their family. So at Parkrun, you don't have to run, as the name might falsely suggest. You can walk it, you can jog, you can run, you can crawl it even, and you can volunteer and also spectate. All forms of participation at Parkrun are celebrated equally. No one's ever last as well, thanks to the volunteer, what we call tailwalker role. And there's no competition involved. It's not a race. It's simply just a chance for people to meet out in the fresh air and have a refreshing start to your weekend. And with Father's Day marking the final day of Men's Health Week this year, it's the perfect opportunity to get involved and to get outdoors with your friends, your family, your kids. You can even bring the grandparents along as well if they're up for it too, and really make a family affair of the occasion. I want to kind of kick off by talking about a bit of impact in terms of Parkrun and what that kind of relates to men's health in particular. And I want to talk to you a little bit about Kyle and his story. It's quite striking in this regard. So Kyle was a passionate member of the Parkrun community. He was 31 years old, and up until December 12 months ago, he was fit and healthy as normal, and he had completed over 130 Parkruns himself. However, last year, unfortunately, he was diagnosed with a rare stage 4 blood cancer, which just changed his life dramatically, as you can imagine. To Kyle, Parkrun was a lot more than just a run or a walk weekly. It was a lifeline for him. It's where he made friends, found support, and even in the most difficult chapter of his life, it was something he truly cherished and looked forward to week on week. During his treatment, he volunteered every Saturday at Setu Arena Parkrun in Waterford, and it gave him an amazing outlet, a new role, and a sense of purpose. The team there really just became a second family to him. In Kyle's own words, Parkrun really changed his life, not just in terms of physical health, but emotionally and socially too. It taught him resilience, connection, and the true value of what a community is. He reflected on one of his most memorable moments when returning to Setu Arena Parkrun as a volunteer after starting his treatment. He said the welcome, the support, and that quiet solidarity he felt from the team and participants that day was something he'd never, ever forget. It just reminded him how powerful a community can really be. Unfortunately and sadly, just over 2 months ago, Kyle did lose his brave fight, but his memory long lives within the parkrun community at Setu Arena, where they held a parkrun in February in his memory. And again, truly encompassed what parkrun and what the community strength is all about there. Just in terms of parkrun in Ireland, we're constantly growing. At present in the Republic, we have just over 540,000 people registered, which is an amazing figure, and I don't think it ever gets old really seeing that number. We've almost hit 10% of the population of Ireland also being registered, so we hope to hit that milestone in the coming weeks. We're also welcoming over 1,000 new participants, or new registrants, each week, and they join a family of over 17,000 people who walk, jog, run, or volunteer every single weekend. And our aim at Parkrun is to have a parkrun event in every community across the country that truly wants one. And we're very proud to have over 160 parkrun events in the Republic and continuing to push for more. We have a real focus now on junior parkrun and new events setting up over the coming years. So parkrun's impact, it's really astonishing, not just in Ireland, but also globally. We're present in 22 countries and we're constantly redefining what physical activity looks like. With that, we celebrate our finish time slowing down year on year, which means we're creating a more inclusive space for people to be physically active in whatever way they can or want. Our finish times have slowed down by over 10 minutes compared to when parkrun was established over 20 years ago. What started as a simple time trial event, funnily enough, in Bushy Park in London, has truly grown into a global phenomenon. We surveyed over 1,000 park runners in Ireland last year to get a true sense of the impact of parkrun on participants' health and well-being. The stats really speak for themselves, and you'll see some of them there on the screen. We've 92% reported an improvement in their sense of personal achievement, 85% reported an improvement to their mental well-being, and 90% of people who volunteer reported a massive impact on how much they really feel part of a community. So what are we doing to celebrate Men's Health Week? Well, at Parkrun, it's a weekly event, as I mentioned, so all you have to do is simply turn up. We'll be asking our event teams across the country to join us in taking one step at a time together for Men's Health Week and sharing promotional graphics and material with them that they can use to post across their social media accounts. And that's really what will work to spread the message on a local level, and then we will look after that messaging on a national level. Parkrun gives you, your neighbours, your friends, father, partner, son, colleagues, brothers, whatever they might be, an important male in your life. It's a place to come together, be together, and celebrate together the importance of looking after your mental and physical health this Men's Health Week. Why not organise a group from work possibly to attend? We would always say you'll never feel the real power of Parkrun until you've seen it and experienced it for yourself in person. So join us the weekend of Men's Health Week. You can find your local event and register at parkrun.ie. It's totally free and we'd love to see you there. Thanks so much.
Tara, that's really superb, and thank you so much. Like two fabulous inputs, Aisling and Tara. And Tara, thank you for bringing Kyle to us as well today, and we remember him and his family as well today. Just amazing how you've told us about Parkrun. Everybody knows about it, folks. Again, we'll have a conversation about it in a few moments' time, where you can use an event to be part of the broader context of celebrating or marking International Men's Health Week. We might have other things that are happening in our own communities that can be very much part of the week without coming up with something else. Now, we're going to just change a little bit and we're going to watch a short video. And we're going out west again because this is Lawrence and his great team out there. A short video showing that when we do get together, we can be greater than the sum of the parts. And these are the kind of things that can happen. So sit back and draw breath and let's have a watch of this little video.
Hi, Neil McNeil here, Deputy Mayor of Galway City. Delighted to be here for the launch of Men's Health Week 2025 in Vigo Higgins hardware store. It's a great place to actually do it. A lot of men coming in off the street, getting their blood pressure checked out, talk about their mental health, cancer screening.
I work for Theo Higgins in Shankill, and we're delighted to be hosting this event for Men's Health Week. And we've had a great turnout here today, as you can see behind me.
We're delighted to be here at Theo Higgins in Shankill and Galway today, offering heart health checks as part of Men's Health Week to the men here in Galway today. It is so important to know your numbers. Blood pressure is one of the leading causes of stroke and heart disease in Ireland.
Hello folks, Elmer Peters here, Healthy County Coordinator with Mayo County Council. We are at Ballina today supporting Men's Health Week in partnership with CRE and HSE.
My name is Michael Kelly from the Community Policing Unit here in Ballina. I'm delighted to be here today supporting the HSE for Men's Health Week.
Hello, I'm Trevor Feeney from Castleconnor. I'm here in Ballina for Men's Health Week. It's important for everyone to get checked. Important opportunity, great opportunity this week especially.
We're delighted to have Cree here this week in partnership with the HSE for Men's Health Week. We're encouraging all farmers and their families to come and avail of the free health checks this week.
Hello, Roy O'Brien here from the IFA in Galway, Mayo. We're delighted in IFA to be associated with Cree and Men's Health Week. So my advice to all you farmers out there is get your health checked, if not this week, next week.
Here at Roscommon Mart, we're delighted to be here for Men's Health Week. We have lots of different information stands and wellbeing checks, and I'd encourage all the farmers here this morning to take advantage of getting their blood pressure and their heart health checked and getting to do as many stands as possible. We're all about trying to keep our farmers as well for as long as possible here in Roscommon.
Delighted to be at the Mart, Roscommon Mart, supporting Men's Health Week. So look after your mental health, look after your physical health. For information, look at apc.ie or hsc.ie.
Hi, I'm Karen from Embrace Farm. We are an organisation who support farm families in the event of a sudden loss through farm accident or sudden medical event. I'm delighted to be here in Roscommon today to support the HSE with our Men's Health Week.
I'm delighted to be here as part of Men's Health Week at Balmart, meeting men where they're at and engaging with them in relation to looking after their head as well as their heart.
It's done. So much happening and so much did happen last year. And again, that's going to be repeated this year, folks. And again, you can see the link up between partnering and the difference that can make when we find one another, find our community, and off we go and we do something together. Now, I have Claire Deasy coming on the screen, and Claire is Health Promotion Improvement Officer down in Kerry and in Cork for community healthcare. I could say loads of stuff about you, Claire, because you've been involved in Engage, connecting with men. You've been on firm ground. You're involved in Be Active, Fun, Fit, and also Move More, Farm Better. And you're going to bring us a little bit of the background to some of the work you've been doing, especially in relation to your farm health as well. So the screen is yours, Claire, and then we'll talk to you again afterwards. Thanks very much.
Great. Thanks a million, Lorcan, and thank you for the kind words. I'm really delighted to be able to present and speak about our Move More Farm Better programme. I suppose from the off, I think it's very important to share that this is a programme that's ongoing, but it's something that has stemmed from, I suppose, small kernels and small seeds that we, when we started working with farmers and members, I suppose, organisations from the agri sector for Men's Health Week over the last 5 years. So, from little seeds and little acorns, big trees grow and all of that, we wouldn't be in a position to have this programme without the initial kind of ground being and the foundations being laid from Men's Health Week in the previous years. So what is it? What is Move More Farm Better? So I suppose we know farmers are a cohort, whilst they're not all male, they are a cohort that do experience, I suppose, more significant higher risk of chronic and occupational illness just due to the type of work they do, the long hours, the isolation, I suppose environmental exposures and things like that. So what Move More Farm Better is, or Farm Better is a health promotion initiative targeted at farmers, their families and farm workers around back, neck and shoulder health. But we're looking at a focus on the ergonomics of farming and preventative strategies. So we developed it in partnership with our HSE primary care physiotherapy colleagues, and also we engage with a number of key players in the agri sector in Cork. And particularly in West Cork. So I'll outline who they are in a little while. The outputs of the programme are so far we've developed a series of demonstration videos. So they're led by physios, the exercises that you can do for back and shoulder health, as well as, I suppose, health awareness videos, which are farmer stories, and they're really wonderful, and some information literature. All of these have been developed, I suppose, with the aim of empowering farmers to, I suppose, take on board the knowledge and maybe take on board tips and strategies on how to prevent or manage the onset of these conditions at an earlier stage. So like I said earlier, we have been working with, I suppose, farmers and farming organisations over the last 5 years, mainly through Men's Health Week. And I suppose, that's the thing that kickstarted this really. We managed to push open doors with the likes of the Marts. So you can see here we've been in Skibbereen, we've been in Fermoy, we've been down in Mid-Kerry, we've been in Milltown, we've been in Ivora, and they have been super, really positive success stories, I would say. At all of those, it was an opportunity to meet the farmers in a positive place, a place where they feel comfortable, where they meet other farmers and have a catch up and a chat. So it wasn't a kind of a place where they felt nervous or unsafe or anything like that. We were fortunate on all of those occasions to have beautiful weather, so the June sun shone, and you can see there down in Kerry they even had a men's choir singing. So we brought a wide variety of health providers and health professionals, both from the HSE and community organisations, because health is very much everybody's business. And I think bringing those services to the farmers themselves at the marts really spoke, really resonated with them and really spoke to them. But in terms of the actual farm, the mart services themselves, they were brilliant. They were so on board with us around those from the off and really welcoming and couldn't do enough for us. So as we came to planning for 2025, we decided we'd like to do something a little bit different, that we wouldn't just focus on events for the week, but rather that we would look at establishing a partnership around men's health in Cork for starters, and then widen it out to the whole, both Cork and Kerry from there then as well. So we reached out to Teagasc in advance, and we presented at one of their in-service days with a focus on farmers' well-being. And the discussion from there is, let's establish a kind of an agri-sector and health stakeholder group with a focus for farmers' well-being. From that, we reached out to a number of the kind of key players in the agri-sector in West Cork for a start point, and I'll show you who those are in a little while. And for Men's Health Week, that's what we had. We had a big focused, our first stakeholder group, where we had, lots of people from those sectors, but also health professionals working in the community, in rural communities rather, as well as a number of kind of health promotion and cancer prevention professionals then as well. And what we did in that kind of initial meeting was that we scoped out, like, what could we do, where could we do it, when could we do it, and how could we do it? So we agreed these potential areas of health and health promotion, but also we agreed what local opportunities were out there that we could work on beyond Men's Health Week as well. So that was in the middle of Men's Health Week there, and I suppose from that you can see these were largely the agri-sector people. So you'd be familiar with Teagasc, you'd be familiar with Carberry, and then it was all local co-op. And there was ones and twos from each of those organisations. There was also people joined in via Teams calls, so there was real brilliant kind of interest and investment from their perspective as to the value of promoting farmers' health and well-being. So our first kind of local opportunity, and we thought, right, here's an opportunity to kind of test a potential program or a potential way of working. We got a great opportunity to literally get out into the fields, and we attended a local farm walk. So this was fabulous again. A few weeks after Men's Health Week, we got to present to over 400 attendees at the local farm walk, and we just presented a number of key health messages. We had Sun Smart, cancer prevention, physical activity and functional movement, and then farming, ergonomics and injury prevention. A really positive day. They're lovely days, and I speak about that in a little while about shining. Health sometimes can be something that people worry about. It can be something that can have negative connotations, and this was a really positive experience. So we wanted to present health in a positive light. So to kind of follow the tone of the event was very, very important. So it was really fun. It was really engaging. Another opportunity arose, and this would be very similar to what we would have done during Men's Health Week. We did a local Mart health awareness event. And again, it was kind of testing this opportunity to see what could we do with our program. And again, we presented on these key messages. We engaged with the Mart managers, we engaged with the Cork Sports Partnership and a couple of the community and voluntary sector to come in. And again, you're meeting farmers in a place where they feel very at home, where they feel very comfortable. And the conversations were very free, they were very there was no resistance to talking about their health, which was really, really wonderful, very enjoyable. So I suppose when it came to developing the program, Move More, Farm Better, it was like there's so much you could cover in terms of farmers' health and well-being. So why did we choose back and shoulder health, and why ergonomics? I suppose we looked at what's already out there, and we scoped out the deficits in terms of existing programs and resources, and we figured that there was very little in this space. And back and shoulder health is so vital. Farmers are the most important machine on their farm, their actual physical bodies, because it's such a laborious type of job, So there was very little really out there. So that was one reason. But really critically is that we got feedback from both the farmers and the agri-sector bodies on the stakeholder group that this is something that they will buy into. And the other bits can come, the bits around mental well-being, the bits around cancer prevention, they can come into the back of it. But for a start point, to get them on board, this would buy them in, because they're very aware of the importance that they are physically fit to be able to do their jobs. Also, we wanted to, for longevity, we wanted to see where we could link it in terms of Teagasc opportunities. So they do a lot, obviously, in terms of health and safety. So you can weave the key messages into their health and safety teachings as well. We also had feedback from our community physios that they were seeing a lot of retired and elderly farmers in their 70s and beyond. And at that point, it was too late to really do anything for them, because a lot of the damage was already done, and it was really just pain management at that point. So let's get the message out there about preventing this and improving quality of life and improving capacity of farmers to be able to farm stronger for longer. And just a bit about the rationale in terms of back pain alone, 25% of GP visits in Ireland related to back pain. And at any one time, 40% of farmers will have some back pain. So there was a lot of really strong reasonings for us to go with that in terms of the programme. The first phase of the programme really focused on development and scoping. So we developed this information and promotional resource. And again, we did this in partnership all the time with that stakeholder group that we established last Men's Health Week. We developed a series of videos to raise awareness of being back and shoulder aware. And we also developed a series of exercise videos demoed by HSE physios. We also have a stock of resistance bands. And I suppose the idea is that we get all this information out to farmers along with the resistance bands, and they can actually, follow along to the exercises. So these are the videos, just kind of a snapshot. So we've two fabulous farmers came on board, Jerome and Teddy, and they shared their story of minding their physical health in terms of being able to farm stronger for longer. And I suppose Jerome is a young man. He's a more preventative piece. And then Teddy was a man who actually did have shoulder surgery. So it was really interesting to hear his story coming out the other side of it. So I suppose that kind of concluded the end of phase one. And now we're in the throes of phase two. And really that's that piece around getting it out to the farming masses. And we're going to leverage Men's Health Week 2026 for that. We're really going to use it as a platform to get the key messages of the programme out there, and also to engage farmers at a number of key events. So we've a communications promotional plan developed for the year, and including a social media campaign. We've kind of started that already with some of the stakeholder group, but it's about looking for those opportunities to meet the farmers where they are comfortable, where they're at. If it's out in the fields, we'll go there. If it's at a conference in a nice hotel, we'll go there. It doesn't matter. We'll go to where they are present and where they gathered. And we're just looking forward to keep it going. So thanks for listening. And, I'd love to come back another time when the programme is at a further along stage. So thanks, everyone.
Well done, Claire. That's amazing work as well being done. Super. And folks, we're getting ideas, initiatives that are happening, really good things that are happening. And as I say, having said that, no action is too small. Some of these are really fabulous initiatives that are happening, especially there in relation to agriculture and farmers. But we've one more piece to go that we'll come back and maybe have a chat about all of this in a short while. Fergal needs very little introduction. Fergal, I won't go on too much about you because everybody knows who Fergal is, I suppose, at this stage in the work that we do. General Manager, Head Stakeholders, Engagement and Communications with the HSE, and very much a champion for men's health on the island of Ireland. I'm just conscious of our time, Fergal, so I'm going to let you go and tell us the story of how the media, especially, and the use of it for ourselves in getting the story out there is all important.
Is that sharing okay there, guys? I'm not sure.
It was in presentation mode. If you want to try and put it into presentation mode again, Fergal. Yeah, thank you very much.
Okay, thanks everybody, and thanks to all the previous speakers. I'm just going to run through this fairly quickly to highlight some of the work that we've done in the past and some tips that may be useful to you to get your men's health work into the local or national media. So as everybody's clear what Men's Health Week is at the moment there in the headline, and in terms of our communication plan in the HSE, we work with our social team, we've got our press team, and we work across some of our campaigns and our key objectives, I suppose, in terms of our communications for Men's Health Week is to highlight the work we're doing under the Healthy Ireland Men Plan. We usually have a press release that helps us do that, announce that. We do that in collaboration with the Men's Health Forum. We usually engage with the Department of Health, potentially on a photo call or a video input from the Minister for Health or the Junior Minister. And sometimes they do an input for our Men's Health Week webinar. We've done a Men's Health Week webinar in the last few years. We've had kind of some high profile speakers there to give their message and support. And you'll see some of them in the next few slides because we've been able to get some press attention from those. We do a podcast usually either in the run up to Men's Health Week with some of the calls to action that you're hearing today, or to focus on a particular theme. 2 years ago, I think it was, that we did the focus on fatherhood with Shane Lynch, who's actually delivering parenting as part of Sláinte Care Health Communities in the Dublin Midlands area. But he spoke very, passionately and gave a lot of insight into the parenting message from a father's point of view, and how he's successfully engaged fathers in parenting, which is something that we need to kind of reach more on. We develop a social media plan with our social team across our key campaigns and put kind of a men's health message, particularly for that week, be it on the tobacco, the quit message, or like we have a vaping campaign at the moment. We have a mental health campaign, and we always trying to kind of reach particularly to men during that week. So that's worked very well for us. But I suppose, as you've heard from all the presentations, Men's Health Week is fundamentally about collaboration and partnership, and that's something that we try and highlight as well through all our communications. That the Men's Health Forum is playing a key role in that, as is the Men's Development Network and Movember and Irish Men's Sheds Association. They're some of our key partners. So here's some of a summary of some of the activity in terms of the press that we got nationally, in 2024. So the HSE press team worked with the HSE Health and Wellbeing to promote men's health among the general public and messaging aimed directly at men and young men. Press release, a couple of interviews arranged, but some of our staff have worked with the likes of the Men's Health Forum and reached on some local and regional radio interviews as well. So Men's Health Week is very popular with local radio stations. So that might be an option for you. And there's just some other coverage that we're able to get in 2024. I mentioned that we've had some high profile speakers on through a friend of a friend. We were able to ask a favor of Rob Carney to come on for 10 minutes, and Lorcan, our host today, and he's been hosting our webinars since we started them back in 2020. Lorcan had a chat with Rob, and Rob just shared something very insightful about his career and about his journey into fatherhood and his adjustment into from the professional sportsman into real life, as it were, away from the spotlight of professional rugby. So that was very interesting, but that also garnered us some attention as a follow-up in the Irish Independent and the Irish Examiner. And here's some, like we mentioned, I know farmers have been referenced a bit here, and Claire was talking about some of the work down in Cork Kerry. They've been able to get some local coverage for that. And we also profiled some of our staff and some of our partners. And there's Dr. Noel Richardson there in the picture there with his wife and daughters to talk about some of his research interest and his work in men's health. So any angle that you can get I suppose, is an opportunity for press attention. There's Lawrence in the picture again. Lawrence has been referenced plenty today, but he's got Aidan O'Shea, the Mayo footballer, in a picture there over in the West. And then there's some, we also got coverage last year in the Irish Examiner as a follow-on to our last year's podcast during Men's Health Week was on healthy masculinities. And we Dr. Conor Hammersley, who was, he's a former Tipperary hurler, but he's working in men's health for many years, and he's currently based in New York. But we had him for a very insightful interview, which we recorded remotely, but that got some media coverage. And then we had Sean Blake, who you may know, and he's participated in some of our webinars as a speaker in the past, about his, eating condition and eating disorders, and trying to put, I suppose, a more open message to men to be more outspoken and seek help when they need it. So in 2025, there's Bernard Jackman. We had him on a webinar, and that managed to get us some attention. I think he was also quoted in one of our press releases. And you can see there, some of that is just kind of the same kind of information that we highlighted for 2024. But if you look down at the regional coverage, that's where I think a lot of people on today could get more traction, that if you have an activity or something going on, or you have a key message that you're focused on for your workplace or for your if you're targeting a key topic. Obviously, men's health is a very broad span of things that you can be focusing on. But you can see that there's a lot of interest from local media. So don't be shy about trying to get access there. And I suppose these are just a couple of things that you could do. You know, like local media can cover Men's Health Week in the run up to it, during it, or after it. If you work with your communications lead, if you're in the HSE, or if you're outside the HSE, somebody that takes part of that, if you're coming from a workplace or a community organization, or to review all your potential communication channels and your communication opportunities. You might have social media, you might have a newsletter, and if you're considering doing a press release or trying to get press attention, make that call, try and get that call in early to say that we're doing this thing. Would you have any interest? Maybe sending a photographer or taking a photograph from us about this event that we're doing in X, Y, and Z. It's very important that you develop your local public health message in line with the campaign. That you're doing a piece that's attached to Men's Health Week, and you heard the strap line about taking one step at a time. As I said there, consider your photo opportunities in the local area. Local reference points are way more likely to get local coverage. So if the Galway Advertiser or the Western People, let's say, get a press release from the HSE and they don't see anything in it around their locality, they're not going to use it, or they're not going to, but if they see some local areas referenced, that that it's come from a local voice and there's local voices in it referencing local areas, they're way more likely to utilize it. So we're developing national content. We're working with the Men's Health Forum. We have health resources on healthpromotion.ie, and so there's opportunity there to utilize that national content at a local level. And as I said, don't be shy on trying to localize it. There's opportunities for you to write a follow-up article about your activities, blog, or a focus piece on a particular issue for your area. It's all, I suppose, opportunities for content creation around Men's Health Week from your point of view, or from your organizations, or from your charity's point of view, wherever you're coming from. We have a partnership this year with the Irish Pharmacy Union around campaigns. So the one of those campaigns is Men's Health Week, and I suppose over the last few years, Jim Curran in the IPU have taken a certain leadership role already in Men's Health Week, but there may be an opportunity for you to partner with your local pharmacy or pharmacies in relation to Men's Health Week. There's men's mental health supports and quit and the Get Active program. They're some of our things that we're going to be trying to highlight throughout Men's Health Week that we think are very important for men. We have a number of new men's mental health supports that were launched last year that we'll be highlighting in the run up to and during Men's Health Week. And obviously our quit tobacco program, and we have a new Get Active program that's launching tomorrow, actually, as part of the HSE app that we'll be happy to share more information on. So that's just my final slide around some of our key channels in health and wellbeing, if you want to stay in touch with that.
That's excellent, Fergal. And it goes highlights again the power of using the media, social media, and all of the above. That's a great screen grab to have that last slide, second last slide, the last slide that we had in relation to that. But remember, Collie Fowler as well, when he was back with us, Collie will have all this information up by the end of the month. There will be a toolkit and a really immediate toolkit as well, how we can get involved in the week, and that's really important. Now, folks, we've run on time because we've had excellent presentations, and you could have left nothing out of what was said and the way it was said here today. So I'm just bringing you back in for a call out, because before we go away, we're just saying to people who are watching today and people who will watch this afterwards, a lot of information has been given, how to get involved in whatever in relation to the week. Can I just give you just maybe a word, or give us a word in relation to your own experience? And there's a lot of experience. We only have time to do this once, I'd say. What do you think is a standout thing for you in relation to saying to people listening today or watching, to get involved, this is really important to keep in mind? You know, what has been the standout moment? The thing that seems to be there for me is the one that find your partners. It just keeps screaming at me, you know. But for yourselves, what has been the make or break thing that you said, we discovered this way of doing it? And Tara, you know, with the park run, I mean, the way it's developed, very briefly, yeah, tell us what has been the secret so we can wrap it up and go.
Yeah, I suppose, you know, hearing Kyle's story, he really talked about that connection piece, and, you know, you really have to be there to experience that. So we kind of say, like, that special feeling is there every week. It's just you have to put yourself in that position to go and to be there and experience it for yourself. So I kind of say, you know, to people, if they're apprehensive or they're not really sure what to expect at first, go with a friend, go with a family member, go with someone you know, and you can experience it with them for the first time. And I promise you, you'll never look back, you'll never regret going it, and hopefully it becomes more of a regular thing then on Saturday mornings for you.
Okay.
I think that's when you get, that's really magic, you know, that if you get people getting social gain from a health gain, or that really has a multiplying effect, that people are leaving an event like that with you know, they're feeling uplifted and they've achieved something from their Saturday morning or their Sunday morning. I think it's a very practical thing to offer people, as you know, that you can do personally or you can do with a group.
Yeah. Well said. Aisling, Galway and Healthy Cities, and again, you really highlighted and illustrated finding the partners, being part of that collective committee, you know, not working in splendid isolation.
Absolutely, yeah. You're only as strong as your partners, and together you can achieve so much. But in addition to that, my advice would be just do it. You know, it doesn't matter if your event is reaching upwards of 200 people, like the fantastic park runs, or if you're sitting around a table with a cup of tea with 5 men. You never know the impact that one of your events could have, and whatever you offer, it could be just the thing that people need. So work with partners, but don't wait any longer. Just organise something. It doesn't have to be spectacular, but it will be.
Yeah, okay. Thank you very much. And Claire, in the context of what you said, is there many initiatives you've been involved in, the programme there in relation to agriculture and farmer health and physical health, especially for the work. It's really super initiative. But just, you also said something, you know, no initiative is too small. Say a little bit about that, you know, because sometimes you say, God, if you don't have too many partners, how do you go about this? What do you mean by that?
I just think you have to kind of be a little bit brave. You have to kind of knock on the door, and you will, trust me, people in the community, be it if it's for farmers or is it for, you know, traveller men, there are people out there who will want to work with you. So as Aisling said there, if it's a small event like a coffee and connect, do it, you know, and that from little acorns, you know, big trees grow. You know, if you stick at it, the partnerships flourish, you know, over time. Like I would say the farmers' health space is probably it's a post-COVID thing. And we have something really strong now in Cork and Kerry. And I think it's that bit about not being afraid, you know, like what Aisling said, the 200 or the 300 is greater. I had the 400 at the farm walk. But if you have 5 or 10, it's worth it. It is worth it. And I think it's about documenting that, learning from it, thinking the next time, what could I do better to improve it? Is there another partner in the community? And I always say this, health is everybody's business. It's just not just me in the health service. There are so many brilliant organisations in the community who will want to come on board.
Yeah,
I was
Well
just
done.
looking at the, sorry to butt in again, Larkin, but
No, I
looking
was going to bring you in there. Yeah, go ahead.
looking at the, like, there was over 420 people registered for today, and I was looking at the list of people, and they're so broad. You know, there's people from local authorities, like Aisling is coming from, and there's people from construction industry. There's people like just from their own interest. There's men from men's sheds who are like either volunteering or attending a men's shed. You know, there's people from GA clubs. There's just so many people looking to see what they can do. And I think that call out that the three guys have just done, Ashton, Claire, and Tara, just did about, you know, take that little step. If you're the simple question you can ask, are you interested in doing something for Men's Health Week, or would you be willing to work with me on doing something Men's Health Week, or is there something you can do very tangibly in your own community or workplace? You know, like the workplaces have seen a massive increase in engagement around men's health. So there's loads of men's, male-dominated workplaces, and they want to be able to do things for Men's Health Week. You know, so there's great opportunities there too.
We'll stay on together, folks, just to say goodbye, because that's a good place to leave it. It's 12 noon. We said we'd land at 12. It's a great opportunities out there to get involved. The 15th to the 21st of June, keep an eye out for it. Come back to Collie when he's back around, Colin at mhfi.org. You will be getting the information, the resources, the posters, the toolkits. It'll all be there, the booklets. We'll have it all ready for you, and you can just ask for it. And as I think Fergal said on another occasion, 6 guys holding a poster in a photograph can actually be used for social media, promoting the week. Anything and everything can make a difference. Thanks to Michael for being here with us. And Michael, you really worked so hard today, because we were going at fair high speed. So thank you so much for being here with us today. Thanks to Jean minding us online as always. Thanks to everybody in the background who makes a difference. Shane is there, and Collie that's not here today. And also, just to say a word to Lisa, she's always there in the background in HSE, and she minds all of us and edits videos and all kinds of stuff for us as well along the way. So Lisa, I know you're there somewhere, maybe not today with us, but you're very, very supportive. Mind each other well. Let's promote Men's Health Week with some joy in our hearts, and let's call us all into maybe that one step. I like that title, and I like the idea of progress, not perfection. That's good. Let's go with that. So until the next time, folks, go well.